Today we're going to talk about the architecture of global health with a special focus and a specific focus on job opportunities in multinational and binational organizations. Let's start with a few definitions. There are multilateral organizations, typically the UN agencies, and the European Union also collaborates on funding for particularly low and middle income countries. There are bilateral organizations, and by bilateral we mean government to government. The United States to South Africa, the United States to Kenya, the United States to Uganda. There are for-profit government service and consulting organizations. Companies like McKinsey, other companies like that do engage in global health work. There are the not-for-profit and service and consulting organizations. These are typically referred to as the NGOs. And really prominent among those are the faith-based organizations. They perform some very important functions. There are academic institutions like UCLA and others, and then of course there are the philanthropies, foundations, and trusts. So we're going to go through each of these and talk about what they do and what the job opportunities might be. Now, first of all, it's very important to understand what the UN structure is. A lot of people get very frustrated with the United Nations because they feel like it doesn't get enough done. But we have to remember, the United Nations doesn't govern. The United Nations convenes. The member states govern. There are 193 member states. There's the Security Council, which we hear a lot about. There's also the Economic and Social Council, the Trusteeship Council, which after World War II was established to oversee the trust territories held by only 7 of the member states. It's really gone out of existence as the member states have achieved independence or integration with the mother countries. There's the International Court of Justice, of course, and then the Secretariat, currently run by Ban Ki-moon. One member, one part of the United Nations structure is the World Health Organization. Now, the World Health Organization is a little bit different in that the Director General is selected by the World Health Assembly. The World Health Assembly meets annually in Geneva. It's the health ministers from all the member states. They select the Director General from among the candidates, and the priorities and budgets are set by the World Health Assembly, which really serves as a board of directors for the WHO. And these are the issues that came up at the 65th World Assembly, May 21st to 26th in 2012. They were interested in universal health care. They were interested in non-communicable diseases, mental disorders, nutrition, the Millennium Development Goals, pregnancy, polio, financing, WHO reform, which is always on the books. So this gives you an idea then of the kinds of professionals that the WHO would employ. Who are they? Well, 70% are medical professionals, medical doctors. 20% hold doctorates in other disciplines, 10% have other qualifications, and you can see the kinds of people they're interested in. Medical doctors, especially scientists, epidemiologists, but they also have to worry about administration and finance, economics, health policy, emergency preparedness, and international experience is usually a prerequisite for being employed directly by the World Health Organization. Now, we'll talk later in this talk about the U.S. government, the Centers for Disease Control, and the U.S. Agency for International Development. Quite often, the CDC and USAID will lend its employees to the World Health Organization. And so there are other employees that are not directly employed by the World Health Organization, but lent by various governments. Another very important agency is UNICEF, the United Nations Institute for Children. And its basic goal is reducing child mortality and furthering gender equality. It has a special program on HIV/AIDS in children because it was felt that children were neglected. Now, of course, the best way of dealing with HIV/AIDS in children is to reduce mother-to-child transmission, and that's really an achievable goal. It's really achievable. It's being achieved in the United States. It's being achieved in the higher income countries. It can be achieved in the low and middle income countries. And having treatment for mothers and children with HIV. And obviously the best way to reduce mother-to-child transmission is to treat the pregnant woman, the pregnant HIV woman, with triple combination therapy. That way her child will virtually be assured of being HIV-free, and she will be alive to dance at her child's wedding. And UNICEF engages in policy analysis, advocacy, partnership, and has a special emphasis on child protection. Now you can see, again, the kinds of employees. Medicine is a very important degree. There's public health, social sciences, international relations, public policy, public administration, specialized training in conflict, experience in program design. Multiple languages is important, especially other UN languages. And it's also the language of the duty station. Wherever you're located, it's really helpful to be able to speak the local language. Now, if you're in Africa, either French, English, or Portuguese would be the languages. If you're in other parts of the world, it might be one of the Asian languages, and it's really helpful. Also, emergency experience. Now, the question is, how do you get that experience? You've got to start somewhere. And that's where short-term international experiences make a difference. The kinds of things that we and others offer. If there are opportunities, say through the Fogarty International Program, or the Fogarty International Center, or through other volunteer opportunities, it's really worthwhile to take advantage of those so that you can put on your resume that you do have international experience. And that way you may get a chance then to work for somebody. Then there's the World Bank. The World Bank is the 50-pound gorilla in the room. The World Bank handles all the money. But it also, so it really does handle the money for the UN. It makes loans to low and middle income countries. It makes grants to low and middle income countries. But it also sets financial policy. And it sets financial policy especially for low and middle income countries. And it has a very large emphasis on cost effectiveness. What health programs are the most cost effective? So for example, that's why there's such a push on vaccines, because there's such a cost effective way to prevent disease. These are their priority areas. Health systems, obviously. Their emphasis has been to look at health as a whole, but they do have specialized programs in HIV, TB, and malaria. Lots of skills training, economic analyses, and it is the world's largest external funder of health. So the World Bank is extremely important. In terms of its employees, if you want to work at the World Bank, a degree in economics is helpful. Public health and medicine, they need health experts, health policy. So if you're a physician and you want to pursue this kind of career, a second degree in health policy, health economics, and evaluative work. They do a lot of the household surveys that try to assess the health and economic viability of populations and develop a lot of strategy. Then there's this other group called the Global Fund to fight HIV, TB, and malaria. And what it does is give grants directly to governments. And the idea is that the government comes up with an integrated plan, and this was intended to be an innovative funding mechanism. And it fights TB, it fights malaria, it fights HIV, and it is showing some success. They want more experience. So that would require, they want more skilled managers. They also need health experts. The headquarters is located in Geneva. French is preferred, and also one other UN language is helpful. So you're seeing here it's not enough really just to even have one extra language. 2 extra languages is helpful. And you can sort of see the areas that they're interested in, budgeting, finance, and they want innovative and motivated individuals. Then there are the bilateral agencies. The U.S. government has several of its agencies involved in bilateral relations. The Department of Health and Human Services, particularly the CDC and the National Institutes of Health, USAID, state, defense, agriculture, all have international programs. And then I put down the other programs of some of the other countries, Australian Aid, DFID, which is the United Kingdom, New Zealand Aid, Germany, Canada, NORAID, Irish Aid. Pretty much all of the high-income countries have bilateral programs. I would doubt that the other countries, the other high-income countries would be interested in hiring Americans. But certainly many, many health professionals, physicians, and other health scientists are employed by the CDC, by the National Institutes of Health, by USAID, as well as by the State Department and the Defense Department. And it's useful to look in all those venues if you might be interested in getting international experience. The priorities are child survival, saving mothers, fostering an AIDS-free generation. Secretary Clinton on World AIDS Day gave a speech to that effect, fighting infectious diseases, family planning, reproductive health, health systems, technical leadership, as well as non-communicable diseases. There is an explosion of obesity in low and middle income countries. Health policy management, promoting gender equality. This is really, really important, particularly in many places where young girls are not given the resources to go to school. And then being effective stewards of public trusts and resources. These agencies have to answer to Congress, and Congress can be tough on them. And it's important that, that the public monies be used effectively. So if we think about employees for the CDC or USAID, most positions do require advanced degrees. They employ a whole wide variety of health professionals, lots of physicians, people with PhDs, attorneys, and people with master's degrees. But if you really want to rise to the top in these organizations, a doctorate of some kind is important. If you want to apply for mid-level positions, you need relevant work experience. But if you go in at the beginning, you can get the kind of experience that you want. Many of the health professionals in USAID are on loan from the CDC, and USAID has missions, aid missions, in over 80 low and middle income countries. There's always a health attaché, a health director, and that health director is responsible for the health budget for that country, and that's typically a physician or some other health professional. The languages are also helpful, but not essential. Breaking in is always difficult, but once you've broken in, it can be a very, very interesting and useful career. Same thing goes for the Department of Defense. Same thing goes for the other departments of the United States. There are faith-based organizations, the Church World Service, Service and Mission, Aga Khan, Catholic Relief, Christian Aid, Lutheran World Relief, of all stripes and varieties. And these organizations do receive and do distribute and do take care of the health of a lot of organizations. For example, we've had a collaboration with a faith-based missionary hospital, and they employ physicians as well. So that's another route to go, both to get experience as well as to do important work. Private corporations, Merck, Johnson & Johnson, Medtronic, Pasteur Mérieux, SmithKline, they have activities in developing countries, whether it be conducting clinical trials or whether it be free access programs, and employ many physicians and health professionals as well. Then there are the other non-governmental organizations, and these are some of the more prominent ones. And again, it's possible to get in, to get an entry-level position, to get posted overseas, to gain experience. If one would want to then move to the public sector, move to the CDC, move to USAID. And it's worth exploring all of these because one never knows where one is going to get a start. The major philanthropies in the world are these, and jobs with philanthropies are very interesting jobs. You get to give away money as opposed to trying to secure money to do your work. But again, experience is helpful, and they typically hire mid to higher level career people. So thinking about going into the philanthropic world is usually a step after, say, government work or work with one of the other NGOs. And then we look at the US, and again, the same is true. Many of the pharmaceutical companies, many of the other foundations usually will hire mid to upper level professionals to run its overseas programs in low and middle income countries. So these are places where one can go after one has experience. And then finally, there are academic institutions. There are many individuals like myself who have spent their lives in academic institutions but have done work in low and middle income countries. Sometimes it involves moving to the low and middle income country and actually working there. Or the other possibility is working from here, but developing collaborations with institutions in low and middle income countries. And that's been my experience. These are some of the leading institutions with activities and relationships in low and middle income countries. These are some others that have major activities around the world. Typically what one has to do in these kinds of situations is secure a faculty appointment and then to begin to develop a set of research or service activities in the low and middle income countries, and then go out and secure the resources in order to pursue that research. Now, what's become more popular recently have been particularly the National Institutes of Health, which is our nation's largest funder of research, has become more liberal, particularly because of HIV/AIDS, has become more liberal in supporting international research. And as I say, this research is typically done in collaboration with academic or other institutions in developing countries. There's the Fogarty International Center, and then various of the other NIH institutes, cancer, heart, lung, and blood, drug abuse, mental health, child health and human development, have substantial international programs. And so it is possible to apply to NIH in collaboration with a low and middle income country partner and secure funding and pursue a career in global health research in these countries. The last point that I'll make is that it all depends on serendipity and opportunity. And one never knows when that opportunity is going to arise. What it takes is some passion, a lot of caring, perfecting whatever craft you want to perfect, casting a wide net, looking for those opportunities, and being willing to take some chances. Some work out, some don't work out. But what I've learned in my trajectory through my life is that if one follows one's passions, and if one does what one is doing now, if one does that well, then opportunities will arise. And then you can assess those opportunities and see if they're the kinds of ones that you can pursue. My career started completely domestically and shifted so now that it's completely international. And now it's balancing out. I'm doing some domestic work and some international work. But believe me, it's a privileged life and a privileged career to be able to make contributions to the health of the world and also learn about the world in a very unique way. Thank you very much.